kit. Remember, we're gonna look at the kit, make sure it's intact. You can read the contents on the here. See if there's an expiration date. Sometimes there is, sometimes there not, and make sure that, you know, there's no damage to this. Now this is gonna be sterile field when I open it up. So when you take the cover off, you want to make sure, so this whole thing here is a sterile field, except for this little lip on the edge. Because we're gonna be reusing these kits, I would keep the lid on or attached so that you can cover it up and put your name on it. Now, this is what it looks like inside. This, again, this little plastic rim is considered non-sterile, which means I can touch it there, but it also means if I drop or touch something that's sterile on this, then it's contaminated. The first thing I can actually take out of here without worrying about, or the thing I take out first actually, are these pack of gloves. These are the gloves that come with the kit. And then the next thing I'm going to take out is the sterile drape, or the sterile field. So, whenever you pick up something sterile, bye-bye. So, you're going to pick it up and move it away from that sterile field in there. Loose side goes down, and I stayed away from this sterile field when I did that. And so I can do this, right? Remember that 1-inch border is considered non-sterile, so I can make this nice and flat. The next thing I'm going to do is open up some of these Q-tips. Sometimes if you have a lump in the middle, the Q-tips kind of roll off, but sometimes they do. So remember, we don't want to be over the sterile field or talking, and not today, doesn't count, talking over the sterile field. So I'm going to open this up as far as I can, and then, and then drop it on the field. So it's really, the inside of this is sterile, and I'm dropping that there. And I only need 3, so we'll see how this goes. Okay, so we're good. I don't need these. So now I cannot turn my back on the sterile field or the sterile incision. The next thing I'm going to do then is put on my gloves. These are nice, these are bigger than the table shoes have. So I'm still great, I can still see everything. This in itself is also sterile field. So sometimes when, again, you're at a facility that doesn't have kits like that, and most of them don't, then you use whatever sterile packaging you can, okay? Just remember the rim isn't sterile. So the first thing I'm going to do is pick up one of the gloves, and I'm just touching this little edge here. And again, you want to kind of go away from there. Put your hand so that it's not down. You want it up so you don't contaminate it. So you get it on, you can't play with it, make it pretty or anything, you just leave it like this. The next one, so now this is sterile. So I can touch this other glove because sterile to sterile is still sterile. But what I'm going to do is put my hand in the cuff, I'll show you like this, to get this other hand in. Sometimes you get your thumb in the wrong, in the pinky finger hole, and you get the pinky in the thumb hole. And that's okay, because once your gloves are on, you can straighten them out. So now I'm sterile. If I wanted to touch this, I could take it from the middle and drop it into the garbage, but it's not in my way, so I'm gonna leave it. So now my hands have to stay up like this, no matter what. So my hands are sterile, everything in here is sterile, so I can move this around. I can take stuff out. So you can take out some 4x4s. The rule of thumb is whatever you took off is what you replace. So if they had 4x4s on there, then you would replace it with 4. Or if they're having more drainage, then you put on more 4x4s. It's just to soak up any drainage. This is that garbage container that you could use. There's a scissors in here. Don't need that. You see where my elbow is? Okay, I didn't go over like that, did I? Okay. So this is sometimes the thing that gets students, and we just will correct you. You'll go like this, because that's how we normally do stuff. You got to get these in so that you don't. So that's where the T-Rex thing. We don't need this. This is that ABD pad. This is that goes over the top, and the blue goes up to the sky. So the next thing I'm going to do, this is sterile saline. Now, regardless if we're on campus or not for the rest of the semester, we still reuse all this stuff, just like we reuse the needles. And sometimes these don't come off because they're so old. I'm gonna stick that here. The next thing I wanna do is gather up 3 of these Q-tips and put them in the sterile solution. I think I'm all set to go. Now I'm gonna start cleaning. So I take my first Q-tip and go straight from top to bottom, straight down the center. Sometimes you have to rotate it to get it over the sutures or the staples. One time, this goes in the garbage. See that? I made it. Oops, not that one. And see, my elbows are always in. Just something that you just get used to. Then the next one goes down one side or the other. So you go down this side. Oh. And then this side. Now remember, in real life and stuff, if somebody has a surgical incision like this, the next day the surgeon will take off that dressing. And we usually just leave it open to the air, or they might put Tegaderm on it. But this is for you to learn sterile technique. So that was the cleaning part, and now I'm going to put the 4x4s back on. You can fold them if you want, or you can put them on flat. When you pick up sterile gauze, if you touch it in the center, and that kind of helps, so when you put it on, you're not touching the skin with your gloves. And then ABD. And then I can take these off because it's too hard to tape it. And then Paul had mentioned in the video that what we call window painting, which makes sure what it does is it seals up all the edges. So the top, bottom, just like a window pane. A little short. But you want it to be occlusive all the way around. Then the next thing you do is, it can be on this cute little label, it can be on a piece of tape. What you're gonna write is date, time, and your initials, so that I know when this was changed. And then you put that label or that piece of tape here. Do not put the label on and then write on the patient. They've just had surgery, okay? And then we would, cover them back up, put their bed back down, and then when you chart, you would chart your assessment of the wound dressing. So it would be, like 9 o'clock in the morning, 0900, dressing change, sterile dressing change performed per, provider's orders. And then I just I don't know how they do it on the electronic health record, but it still should be pretty much the same, where you can click on where that wound was and what did the drainage look like, how much was there, and then what did the incision look like, were the wound edges approximated, are the sutures intact or staples, how many staples were there, and then what did the wound edges, the surrounding skin look like. So that's it, and then you would, actually you're gonna have to repack your kits. I want you all to practice just putting on sterile gloves though, because that is not an easy thing. It gets easier. And then we're gonna have to repack those too. And just, so if I were for practice, I'm done, but for practicing,